Expert Dr. Cedrek McFadden today as we talk about gloves that you see people wearing and COVID-19. These gloves, Dr. C, can give people perhaps a false sense of security.
They do, but the intentions are good.
Right.
I mean, if you think about, we've been telling folks, wash your hands for at least 20 seconds before and after you do anything, really now.
Right.
But there are times which you can't wash your hands, whether you're at the grocery store, you may not have access to hand sanitizer. So the theory behind it, the intention is good, but like you said, it offers false hope because, you know, you still can touch your face, you can still touch contaminated surfaces
so if you
with those gloves.
Yeah, if you do all the things you're not supposed to do without gloves, with gloves,
it becomes a second set of skin for
you defeated the purpose. All right, so when should we wear gloves?
So on average, you should think about if you are taking care of someone who is sick, someone who has tested positive for COVID, and perhaps you're doing laundry and the laundry is soiled, that might be a good time to wear gloves. But on average, you really don't need to wear gloves. If you're walking outside, there's no one close near you, you don't need to wear gloves because the virus itself isn't transmitted or absorbed through the skin. It's absorbed as respiratory droplets come into your own body. One
of the places I've seen them the most in terms of just regular folks wearing gloves is at the gas station. I keep seeing people pumping gas with it. Does that, if you wind up touching yourself in any way with the glove, you've defeated that purpose, but does that help at all, or are there other ways to handle that?
So you've seen folks actually use the plastic bags and things that you can dispose of quickly. The key is before using the gloves and after using gloves, you still want to wash your hands. You want to be very careful how you remove the gloves so that you don't contaminate yourself.
How do you? Yeah, let's show how we remove a glove, because I think that's important to understand. As Dr. C puts his glove on, I'm going to put one on just to... Okay, so I got one on, and so I've worn it. I've done my thing. Yeah. It's soiled.
You've touched a contaminated surface. So you don't want to touch your face now, but you like to just remove the glove by touching the outside of one and peeling it off. Now, you don't want to then go for here with the other hand. You want to go on the inside and then remove.
Oh,
and then here's the key. You want to dispose of this in the trash can. You don't want to put it on the surface, on the ground, where someone else has to come up. We don't want to produce a problem with the litter. You want to be very careful that you place that in
an appropriate trash can.
Correct.
And then you want to wash your hands.
Then you wash your hands again.
Because you may have touched a little bit of the contamination.
You may have, and again, it doesn't do you any good if you then touch the glove itself after having them on for that purpose.
In terms of when you change gloves, I mean, how many gloves does a person really need if you're going to be all into this glove scene? So
we change gloves as physicians all the time. Between every patient encounter, between every exam. Sometimes you may even change between one visit 2 or 3 times, depending on what you're doing with that patient. The same should go for anyone else wearing gloves. You don't want to just put a pair of gloves on in the morning
and wear them all day.
And wear them all day. If you're going to wear them, you need to be changing them frequently, washing your hands frequently, because again, it's not, you don't want to create a sense of false hope.
And in terms of the supply of gloves, right, we don't want to wear healthcare masks because healthcare workers need them. I mean, is there a limited glove supply, and are we endangering healthcare workers by not leaving the gloves to them? So with any product, we have the potential of having limited supplies. Fortunately, that hasn't come up as much as the conversation around masks, but we still want to be very protective and careful that we don't just go through products that we could potentially need down the line. All right, well, Dr. C is back with your medical questions. We got some answers to your medical questions on live at 5 today, so make sure you're watching. And if you do have a medical question right now for Dr. C, go to the 7 News Facebook page and post it there, and we'll look at which ones we pick for live at 5. Yes. Thank you, sir.
Thank you.
You're watching Carolina's Family at 4. We're coming right back. Stay with us.